Hi, welcome to this video. My name is Michael Hurst with fecaltransplant.org, and today I want to discuss with you how to do it yourself when it comes to fecal transplants, also known as fecal microbiota transplant. Now, why would anyone on earth ever want to do this? Certainly, that's a question I very frequently get asked. In my case, I'd suffered from ulcerative colitis for over 12 years. And after hundreds of thousands of dollars have been spent on my care, after every drug that had been prescribed to me had failed to work, and even after dietary solutions and probiotics still failed to deliver a lasting solution for me, I was 3 days away from surgery when I found out about this one option that doctors had not told me about. And it made perfect sense to me. Basically, by taking stool, poop, from a donor, you can actually get all the helpful bacteria that you have in your colon, in your gut, in your intestines, that help you digest food and also prevent harmful bacteria from taking over and causing illnesses. In fact, this is actually another cure for this includes Clostridium difficile bacteria. This causes antibiotic-induced colitis, also known as pseudomembranous colitis. What happens in this case is someone maybe goes to a hospital or a nursing home, and then after they've been treated with antibiotics, wipes out all the good bacteria, and then bacteria like Clostridium difficile comes in and creates inflammation and an infection that resist antibiotic treatment. The way to treat this illness, as well as ulcerative colitis and Crohn's disease, in a way that actually works, and works past the treatment period, is to use stool. So what I want to do today is outline what it takes to do this yourself in about the next 10 minutes and leave you with a greater understanding that yes, there is a lasting cure for this disease that does not involve drugs, that does not involve restrictive diets, and leaves your physical body intact. Something that up until now, the medical community, the Western medical community I should say, does not believe exists. So first I want to go into your donor. Certainly, one of the most important things to start with is a healthy donor. Now, one thing that's pretty commonly done is people will pick someone they're often already living with. This could include a husband, a wife. It could include children, a parent, or parents for a child as well. I've also heard cases where people use their grandparents or sometimes other relatives. Certainly this can be helpful because you can trust that you know the person's medical history. Hopefully you can, at least, if it's someone in your immediate family. And also, there's the added advantage that that person either lives with you or possibly can stay with you for a while, or vice versa, you can stay with them. In my case, once again, irritable bowel syndrome did run in my family, and sometimes stressful conditions would cause diarrhea for others in my family, so I wondered if they would make the ideal donor. Also, they were down in Florida, and I lived in Washington, D.C., and I wanted to continue to live and work and stay near friends in that area. So I recruited a friend of mine. Actually, this friend of mine used to be a client for my dating coach business. I know, pretty strange, right? Plot thickens. Well, I knew him pretty well, I guess you could say, since I had been his dating coach. I knew a lot about his personal life and lifestyle, and I knew that he'd be a pretty healthy donor. However, I also gave him the donor screen that I'd actually originally gotten from a doctor and have published a version of in my book as well. So you can go through there and find a donor that's likely to be free of transmittable illnesses. What are those illnesses? Bloodborne sexually transmitted infections like syphilis, hepatitis, or HIV. Those are ones that you would commonly test for because they could be passed by blood. However, even in the off remote chance that someone had these, it would require that they actually had active live blood in their stool, and then that you had an open Kuiper sore that blood could get in there through. Nevertheless, we want to do a screening to identify someone who is unlikely to have these illnesses, and then do a blood test. Another thing you want to do is make sure that this person doesn't have stool-borne parasites or pathogens. And so testing for common ones, including Giardia and Cryptosporidia, and also seeing if anyone's ever had traveler's diarrhea from traveling to countries where parasites are relatively common. This can include parts of sub-Saharan Africa, parts of South America, parts of Southeast Asia, oftentimes tropical climates where traveler's diarrhea is more predominant. So you want to know the person's lifestyle in terms of sexual history, behavior, and you want to know the travel history, and you also want to know their medical history. What illnesses have they had? Because in most cases, if someone does have parasites that are transmittable through stool, they probably had traveler's diarrhea types of symptoms in the past. If they had hepatitis or syphilis, once again, symptoms would have presented for those illnesses. So that's one thing you want. You also want your donor to have regular bowel movements, basically about 1 or 2 times a day, a good, solid, regular poop. Basically that is because the bacteria from their digestive process will end up becoming your bowel habits once your digestive tract gets healthy and happy. So if you've ever said, wow, I wish I had poop like that person, congratulations, now you can. So that is the good news. So from there, now that we've got our donor, let me go on to our next spot, which is gathering your supplies. Now this is actually remarkably simple, considering perhaps all the complex medical procedures or drugs you've taken in the past. All these supplies you see here, except for the stool, which has to come from a healthy donor, can be purchased at your local neighborhood drugstore or grocery store. So what do we have? Well, first a little cleaning supply. You want alcohol wipes. These can be used to clean your hands afterwards, in addition to soap and water and hand sanitizer. And these can also be used to wipe down surfaces. You might also want to keep around Clorox wipes, once again for cleanup after you are done with your fecal transplants. Another thing we'll want to have is a rectal syringe. So basically what we're going to do later is actually squeeze the bulb, almost like a turkey baster, and then it will sort of suck up the mixture into there, and then we'll put the nozzle back on to our rectal syringe. So a rectal syringe is another item that you want. Some people use enema bags. If you're doing it with a doctor, they might use a colonoscope, which is basically the device used for colonoscopy, and it can sort of essentially pipe it in with a small tube, almost like a hose. This would actually get it farther up into the large intestine, and if that is an available option for you, I would recommend being able to do that. However, it is hard to find doctors willing to do this, and I've talked to many people who, even when they have found doctors that were initially interested in doing so, they oftentimes lost interest when they realized the amount of red tape they might have to face when it comes to getting permission from hospitals, because they usually have to use hospitals' facilities unless they have their own outpatient clinic, and then also FDA approval, which now, if you actually follow the letter of the law, there's over a month-long application process to do this. So that is why a lot of people are going to be doing it themselves. Nevertheless, rectal syringe can work perfectly fine. As you can see, it's relatively low volume, which means slightly less of an impact on your gut here. It's inexpensive. It costs $10 at CVS. And also, it's much easier to do than having to hang an enema bag, which might require a hook on the wall or some other type of device to hold it elevated in the air and use gravity. In this case, we're going to use hand power and how we position our body to retain the enema. Another thing we want to have here, of course, Gladware containers to contain your stool. In my case, what we did was we had a stack of these on the next to the toilet for my donor. So every time I went to the bathroom, he gave me a poop sample, and then it went to the refrigerator if I wasn't there to use it right away. You can store these for approximately 5-6 hours in the fridge without bacteria starting to break down. This can be helpful. Some people have also frozen stool before. I did not do this myself. However, I have read of case studies where this has been done before by both doctors and by patients who have had successful results. Another thing we want to combat the smell, something like Vicks VapoRub, Vicks. This is oftentimes what you see sort of crime scene detectives go ahead and put under their nose when there's going to be dead bodies because there's been a murder, something like that. So in this case, if you want to try and avoid the poop smell a little bit, that can be one way to help. Of course, you could also always put on nose clips or other things of that nature. Another thing, perhaps one of the most important things, is to have rubber gloves to put on. Another thing, especially if you're not working in conjunction with the doctor, is you'll need to get sterile saline. You'll need to get that, put in the blender here, and mix with our stool. And if you don't have a doctor's prescription, you can't get a large bottle of this. However, just so you know, it is the same stuff as contact lens solution. It is the same stuff used for IVs. And I was told that they would not sell it to me without a prescription because I might somehow use it to mix with, say, heroin as an illicit IV drug user, which I really honestly think the reason for this is because when they sell sterile saline, a bottle like this marked for contact lens solution, you pay what? $4 or $5, even $10 possibly. However, the 5-liter container that they had, which is literally this tall, was only about $5, $6, $7 through the drugstore. So I think maybe part of it is protecting the contact lens industry, and not because people are going to do something harmful with diluted salt water. So what you're going to do is, I would say, make your own saline. Now, for all those of you out there who think this might be really complicated, I figured it out by doing a quick internet search. It's 9 grams of sodium per liter of water. Here I have a gallon of distilled water. This is clean water. Now remember, this water is going up into your gut. So for any of you out there that believe you need to sterilize it by boiling it or other things like that, you could. But in most cases, normal water that's free of chlorine and other impurities is going to be more than good enough. So I use distilled water. And so there's also markings here on your blender, which I almost neglected to mention. This was the $20 special at Target. Rinky-dink normal blender. You don't need anything complicated, especially since I'm willing to bet you're probably not going to want to use this after this. In fact, a joke from some of my friends a while back was, oh, well, if I go over to Michael's, I am definitely not going to have blended margaritas or daiquiris because I don't know, where that blender's been. So I would recommend getting a blender from a yard sale or an inexpensive one from the store. Don't spend more than $20. Just something that works. So what are we going to do? Well, first thing we'll want to do, the very first thing you might want to do is go ahead and put on some Vicks Vapor Rub here before you get started. And then you want to put on some rubber gloves, or I should say latex gloves. Consideration as well, if you have latex sensitivity or allergies, you might want to get hypoallergenic latex gloves. So anyway, we have our gloves here. Keep these on. Another thing that can actually make gloves easier is some gloves actually include some degree of lubrication on the inside. This makes it easier to slide your fingers in. And as you can see, this one is not the easiest to get on. There we go. In fact, actually, that's what happens when you put gloves on the wrong way. It's been a little while since I had to do this myself for my own fecal transplants. There we go. Alright, so we got some gloves on. Next thing we're going to do, take some of our stool, which, before anyone freaks out here, oh my god, he's got poop. No. It's banana, and I covered it with a little bit of dipping chocolate. So, chocolate or banana. And there we go. Alright. So, put our stool in here. And we want to get it to kind of lay flat, sort of. If this were real stool I'd be working with, I'd probably use like a spoon or a fork or something. In most cases, it kind of falls apart a little bit. You can either put it in first, like I did, or you can put water in and then put this in. I think it's a little bit easier to put the stool in first. The next part in our recipe here is we'll pour some water in. Now, most recipes I've seen have said to use anywhere between about 200, 250, maybe up to 500 milliliters. That's a half a liter of water, of course. Oftentimes, after the first few times I did it, I started to eyeball it a little bit. But you do have a measurement here on the side of your blender. You pour the water in there. And so I started out by using about 500 milliliters. Over time, I reduced that amount to probably about 250, just enough to cover the amount of stool I had. And usually I would use all the stool that was given to me. You don't need to do that, but if you have a good solid-sized turd, that's probably enough, and probably more than you actually need. So anyhow, pour in a little bit of water here. Eyeball in it. And there we go. All right. So that's about 1 cup there. And right there we have just about half a liter, about 50 milliliters. So from our 50 milliliters there, we'll want to add in some salt. Now each of these sterile salt packets here, which you can use for a nasal rinse, each one of these packages has 3 grams in them, as we can see on the label. So if we have 9 grams per liter, that means if I had a full liter, I would use 3 of these. Since I'm using half a liter in this example, I'm going to use just 1. Oftentimes when I did these, I would actually pick a spot sort of between about 250 milliliters, that's 1/4 of a liter, and 1/2. And then you'd use just about 1 salt packet. Now this doesn't have to be perfectly exact for the salt, but having a little salt in here will make it a little bit more tolerable for your body. So we add in some salt. So I'm going to put in about 1.5 of these. It's funny, right? They're just like sugar packets except for salt. So there we go. It's like I'm the Swedish chef here, right? So we have some salt in here, we have some stool. Now we want to make sure this is tight into the base, because if it's not tight in the base, then stuff will literally go everywhere. We do not want that to happen. So there we go. All right, that's in here pretty good. So we have that, and then what you're going to do is press the blend button, and we will blend it. So ready? Alright, there we go. Now, when I read Dr. Silverman's report on how to do these at home, this was published in one of the medical journals I read, he mentioned to mix it to a chocolate milkshake-like consistency. So notice here, when I went with almost 500 milliliters with what would be about an average sized turd, it's actually a little bit watery. So this is where you might want to use a little bit less. Another thing you can do to make things a little thicker if you want is to pre-mix your saline mixture with a little bit of benefiber or some other fiber, which is basically gluten-free wheat or cornstarch. So that starch will help give it a little bit more thickness if necessary. However, I did not do that, and it worked for me. So you just mix it together. Now, fortunately, you took your Vicks, right? So this won't bother you. Then you have your container. You can use either a different one or your same one. And we take our mixture here, and we pour it into the container. Not as much as you can. Sometimes it will actually be more. You'll actually have a little bit more than you can actually use for here. Now that's okay. We set this aside. Now in the meantime, what you will have wanted to do as well is lay out your next step, your enema station, if you will. So the way to do this is you're going to have, I would say, put some plastic garbage bags on the floor. This also helps if you have a pillow to lie on. So if you have a thick carpet, what you'll want to do here, and by the way, mix the poop, now administering the enema, we have the garbage bag. So I would say put 2 of these on the floor. One for you to put your rectal syringe and other stuff. And another covering a pillow on the floor, which you can lie down upon. So as we move the camera here to lie down on the floor, actually here I'll move the table instead. Alright, so we can see. Okay, so here's how this is going to work. So here's what I recommend. You take the nozzle for the rectal syringe and you squeeze it in. This is what sucks up the contents. All right? So there we go. As the bulb fills, it's full of your solution here, your slurry or your filtrans mixture. So here you go. So now we have this. Now this is where your alcohol wipes, once again, come in handy. This way you can wipe the surface. Wipe it so it's kind of clean. Remember, we still have our gloves on, which are helpful. Make it a little clean. Then what you're going to do is, ideally, have it fully stretched out. This is a tiny garbage bag, actually. Here, you're going to lie down on the floor, and so as the camera tilts, of course, to follow this, right? You want to lie down on your left side, right? So here's how we do it. Lie down on our left side. We have a plastic garbage bag over here. Basically put it down on here. You might also put this down in another flatware container. This can be helpful. And then essentially you're going to lie down here on your left side like this. This is because the colon, first, if you look at basically an illustration of image of the colon, what it does is it goes through the rectum and it curves. Then it curves sideways for the ascending colon. It curves back again. Then it curves again the other way for the descending colon. So what we want to do is position our body so that the mixture navigates its way up through the colon. So we're going to take this, we'll lubricate the tip just a little bit here, maybe with some KY jelly or something else like that. Maybe, I know, lubricate your anus just a little bit too, or just a finger. Nothing that a good Hollywood star hasn't done. And then you're actually going to insert the tip, sort of slide it in about up to this little hilt here. So you're just sliding it into the rectum, about the length of the pinky finger. And then what you want to do is slowly squeeze the bulb. Squeeze the bulb so the contents come out. As you squeeze it, you should feel the mixture coming in there. You feel a little bit of pressure as the mixture comes in. And you want to keep squeezing it until the bulb is basically almost empty. I say almost because when you're tilting it down a little bit, I'm not going to tilt it down as much as I would, since this stuff will leak out. But what you'll do then is tilt it down, squeeze the stuff out. There might be a little bit left, that's okay. If you keep squeezing and stuff is not coming out, and you realize that you've got about half the mixture left in here, that means that the nozzle is probably clogged. Now what you can do is you could pour the mixture through a soup strainer to make sure you get large particles out. Or if you go on liquefy, usually the blender will break up any large particles for you, so this will not be a problem. If that is a problem, what you might have to do is actually back flush the tip. You may also have a wire coat hanger, and you can actually push that down the tip and quickly dislodge any large particle. In my case, I did these for over a month, and that was never a problem. I did have to dislodge it once or twice with my little wire coat hanger. So you have a wire coat hanger here, you have your fecal enema mixture. So you're lying on your left side, and once it's in there, next thing you'll want to do, keep in mind we have like a pillow here, is you're going to elevate and then maybe lie on your back like this. You could be reading, watching TV, all kinds of things. You can be hanging out with friends, which I actually did once or twice, believe it or not. Then you can lie on your right side for a little bit. Once again, this is so the mixture travels through the colon. Then eventually maybe back to your back, and just kind of lie here for a while. So essentially, volume is by no means filling up the whole colon at all. What we're hoping is that as the mixture travels down, that the bacteria is coating it, and it's getting in there as far as possible. When it comes back, it will also go there as well. And when the mixture comes out, not all the bacteria is going to be lost. So you do that, and in the meantime, you've had your rectosporidium sitting here. Well, hold it as long as you can. At first, this may not seem too long. There is a little bit of an art, a little bit of a learning curve to this, but that's okay. You'll get better with it. After that, what you can do is simply gather your supplies by keeping your garbage bag, and then I'm going to go back to my little station over here after I gather my supplies. Gather it up, and this makes cleanup easy. So any wipes that you have, alcohol wipes, any toilet paper you might use to wipe yourself, carry it back where you need to go to clean up. So, there you go. Thank you. So we have all of our stuff here. Back in the bathroom, we might have some extra slurry. You can dump this down the toilet. We can also clean up our mixture here. In this case, just squeezing the stuff back out. Now, if I was right in the bathroom, I'd be oftentimes squeezing this straight down the toilet. And then what we'll want to do with some sort of a basin, maybe a larger Tupperware container or other container like that, or a small bucket, is we'll go ahead and use soap and water. We'll suck the soap water mixture up into here, squeeze it back out again, and then leave this to air dry once we've got the excess water out. This is important because, first off, we want to use soap and water and not bleach, because bleach can destroy bacteria, and in this case we actually want the bacteria. I know normally you want to sterilize and kill all the bleach off, but in this case we don't want to do that. Also, bleach can be an irritant to the gut. So soap and water, wash it out. Same with your container here. You can throw it out if you want to. It's Gladware, it's cheap. If you're a cheap bastard like I am, you wash that with soap and water, and we just reuse these as well. Good as new. By the way, this actually cleans up pretty fast if you haven't had time to harden the cake on. We take the rest of our supplies, same with our blender top, put some soap, water in here, swish it around, dump it down the toilet, and flush. And your whole process, in terms of mixing this, can take about maybe 5 minutes or so. Clean up about 5–10 minutes. Let some of these things air dry. Once they've been cleaned, they should not smell. And at that stage, you're done to fight another day. A couple of other quick things. To retain the enemas better, it helps if you make sure you do this after you've already had a bowel movement. So probably a good amount of time after you've eaten. Oftentimes when you have digestive disease like this, if you eat, it'll cause urgency and you'll have to go to the bathroom. So I'd recommend waiting at least 2 hours or so after eating, and after going to the bathroom after eating, if that frequently happens for you. I would also recommend taking Imodium and or Gas-X about an hour before you go and do this. By the way, when you take the latex gloves off, if you pull like this, inside out, like this, and use the inside of the other glove to take the other one off. This is how you can avoid touching the fecal matter, as well as by washing. So you take all this, and then Imodium about an hour in advance. Gas-X will help with any bloating or gas that happens with this. Some other things I recommend in my book, on my website, are to do as much as you can to control inflammation. This can include being on prednisone in advance, and while you're doing the fecal transplants. It can also include antidepressant drugs like Wellbutrin, that has anti-inflammatory properties, and also drugs like Doxepin, low doses of that are used for sleep aid. That can help because it calms your gut. Less spasms means it slows diarrhea. A lot of other antidepressant, anti-anxiety drugs can do the same and provide much more solid continuous coverage than something like Imodium, where you take it and it lasts 4 hours and then wears off. So anyway, that's my presentation on how to do it yourself when it comes to fecal transplants to treat Clostridium difficile, ulcerative colitis, and Crohn's disease, among others. And for more information, please go to my website, fecaltransplant.org, and check out my book. Thank you very much. This is Michael Hurst. Have a good day.